I am good. Can you hear me okay?
I can hear you great. I
Okay,
can hear you
awesome.
great. Um, Thank you for joining me today. I've just introduced you,
Mhm,
and I want to dive right into questions I have for you
mhm.
so that we have time to take questions from people towards the end.
Yes.
Um, you are a menopause trained clinician. I'm curious about how often patients talk to you about their skin. Do you find that women realize that changes are happening? Do they know that it's connected to hormone decline? What are the common symptoms or the common skin changes that you hear from patients?
Well, I think, of course, women know that around this time, 40s, 50s, right, that they notice skin changes. But I think many of them do not understand that it's many factors are involved,
Right.
but the dramatic shifts in hormones are one of the factors. Of course, photo aging, right, exposure to the sun from all those years, right, other aspects of aging, other environmental exposures, things that are going on, right, can impact your skin. But the hormonal changes are a huge part of it.
Yeah.
And just like doctors and patients in general are not knowledgeable in general on menopause, that trickles down to skincare, right? And so
Sure.
I think there's a lot of band-aids thrown at women's skincare, a lot of expensive band-aids thrown at women's skincare. And we actually know from science and data that there are some really good workhorse, really proven, really safe ways that we can address skin changes. But I think a lot of women don't realize that, right?
Yeah.
They're spending their money in a lot of places that they don't need to. And in terms of the most common skin issues that I see reported from perimenopause and menopausal women who are seeking my care at Alloy is, certainly dryness, irritation, right? Thinness, certainly complaining of facial skin changes, right? Noticing like more hollowing underneath the eyes, more prominent, lines, around the eyes, around their mouth, their neck, but also just overall
Yeah,
dryness,
so glad you
irritation.
said that. Yes, I neglected to think, so often when we talk about skin, we're talking about facial skin, but
Yeah,
changes are happening on our
everywhere.
skin all over the body. Yeah, everywhere. Thank you. So many of us are told that this is just a part of aging, right?
Mhm.
Not necessarily perimenopause and menopause like you're alerting
Yeah.
us to now, but what's actually happening beneath the surface? How is hormone decline impacting the skin?
Yeah. So skin changes, your face or anywhere else are many factors are involved. But from the hormonal standpoint, with the loss of estrogen, right? Remember, there are estrogen receptors everywhere in our body, including all of our skin tissues. You hear us talk a lot about the genitourinary syndrome, menopause, vaginal dryness, pain sex. Well, let's just face it, that's skin. Right?
Right.
That's vaginal skin, that's vulvar skin. So that sometimes makes like it clicks with women when
Yeah.
I kind of say like the skin is not that much different there and here, right?
Right.
And so when we see that thinness, that dryness, et cetera, happening down there, the same thing is happening here from the loss of collagen, the loss of hyaluronic acids, of fibroblast, of elastin fibers. There's lots of this, kind of the support structure of your skin. And we'll focus on the face, of course, but this is happening everywhere, starts to break down. That's why we
Right.
see not only fine lines and dryness, right? But there's decreased health of the skin barrier. There's a loss of skin thickness. Wound healing, is
Yes.
impaired, right?
Yes.
People will say it takes me longer to heal from things. And so, this is all a complex, interplay between obviously photo aging, but also that loss of the building blocks of skin health. And estrogen is really a mediator of that, right? It directly impacts, collagen production and all of these other supportive things that keep your skin kind of supple and
Right.
healthy and the barrier healthy, right? And we know systemic hormone therapy does improve skin quality across the board. Menopause Society position statement clearly outlines that and what the loss of estrogen does on your skin. We know what it does to the genitourinary syndrome. And so we'll kind of talk about the differences between what does systemic hormone therapy do to your skin, what does
Right.
local hormone therapy do, and why we develop something local for your face.
Terrific. So you have segued us perfectly to my
Yay.
next question, which is, can you explain what estriol is and why alloy, why we have chosen it as sort of
Yeah,
the hero ingredient in the
sure.
M4 line?
Yeah, I think it's important to understand that your body produces a number of different types of estrogens throughout your life. Estrogen is kind of just a catch-all phrase, right? And
Yeah.
we have estradiol, we have estrone, we have estriol, right? Estradiol is the hormone that we mostly think about when it comes to reproductive health and developing breast tissue and, supporting your menstrual cycle and fertility. And there are receptors, alpha and beta receptors throughout your body and all tissue to estradiol as well as to estriol. Estriol is the predominant hormone in pregnancy. Okay, very, very, very high levels in pregnancy. And then when you're not pregnant, your body makes very little of estriol. And when you're comparing the two, estradiol is 10 times more potent in terms of its impact on the receptors than estriol. But they both are impactful on receptors. When you look at the literature on the use of topical hormones on skin, and let's just kind of make sure everybody understands that I had kind of alluded to systemic menopausal hormone therapy,
Yeah.
MHT, some people call it HRT, right? That's in much higher levels. The FDA approved options are estradiol, much more potent, higher levels, gets absorbed everywhere, helps with hot flashes, night sweats. That's very different than what we're talking about today, which is local low dose hormones, right? So the common example is in a vaginal estrogen cream or other local vaginal estrogen products that are already FDA approved to help skin down, right?
Okay.
So that's local, not systemically absorbed. When we look at the data on the local application of hormones for not systemic absorption, but for skin health, there's data on both estradiol and estriol, right? And so estriol, the difference is that while it's effective on receptors, its potential for systemic absorption or even systemic effect, if theoretically anything did get absorbed systemically, is that it's so weak, particularly very
Right.
weak on breast tissue and very, very weak on uterine lining tissue. So when we're looking at developing a custom product for facial skin, because frankly, Rachel, for more than 2 decades, this obvious
Yes.
option that we know helps skin because we have it FDA approved estradiol and estriol in Europe. That's what they use for their vaginal dryness products and for their GSM products. We know it works, but
Right.
we all know that after the Women's Health Initiative, there was very little appetite or interest in anything to do with hormones. It was like, they
Yeah.
get the red X on their face. So for no reason, right? And so there was just literally lost interest in this. And so we were like, hey, like we should be interested in this. And in fact, there are studies. Would we love even bigger, longer term studies? Sure. But there are studies
Yeah.
and plenty of studies. And what we found is that there was very good studies showing that there was effectiveness of estriol on facial skin quality. And so considering we're making a custom product, we went to go with an estriol because we know that from a safety standpoint, it's much less potent and there's way less potential, in terms of stimulating receptors other places. And there are alpha and beta receptors, right? And so estriol is a little bit more prominent on beta receptors, and there's a lot of beta receptors in our skin. So for a lot of reasons, and you can look back at all of the literature we have like linked on our website about it, but there's a lot of good reasons why we chose estriol, right?
Okay.
From a safety as well as an effectiveness standpoint. So
That's
yeah,
fantastic. Thank you for that breakdown and
yeah, I know it's a
explanation.
lot, but yeah,
It's a lot, but we'll be
yeah.
threading in and out of it as we go. A lot of women may be wondering, and you did say this, but just for sake of amplification, I'm on systemic hormone therapy. Do I still need or
Yeah.
want to use topical estrogen in my skincare? And if I'm not on MHT, can I still use
Yes
M4?
and yes and yes. So
Okay.
basically, we know from all of the data on the genitourinary syndrome of menopause is that at least 50% of women who are using systemic hormones for their hot flashes, etc., still need topical local application of an estrogen to help with their GSM symptoms, right? Same holds true with face and other skin, right? Because systemic hormone therapy is going around your bloodstream and getting to those receptors in your brain and your bone and other places, right? But it takes a lot and persistent use of it to get
Right.
directly to the receptors on where you need it to be. I like to remind people it's kind of like, say you have a really, I don't know, allergic reaction, or you have some autoimmune disease or some issue where you need to take oral steroids like prednisone. That's
Mm,
going all throughout your body and it's really powerful and really potent. Versus you have a local rash or some other skin thing, and we give you a low dose, low potency, topical, either over the counter or prescription based steroid cream to really get to really where the
right.
problem
That's a
is.
great, yeah,
So
that's a
that's
great.
kind of how you need to think about it, like that.
Okay.
And so systemic hormones can help, but you're going to target it a little bit better by doing local. And some women don't need, or cannot be on systemic hormones. And so they still want to target things. We know they
Right.
can target things vaginally for GSM. And yes, they can target things with their face. So, yeah.
Terrific. Thank you so much for that. Super, super helpful. Okay. What is the difference between using M4 and something like tretinoin? So, do they do the same thing? Are they meant to work together? How can we think about
So,
these two products?
so really important. Tretinoin is super well studied. We've got such robust evidence on it, and it's really one of those workhorse
Yeah.
mainstay ingredients. And we do prescribe it at Alloy because we know that it's an important part of skin health and keep healthy aging of your skin as we get older, right? But they really complement each other and they work in different ways. So tretinoin works on, and I wanted to make sure I said this right. So, the retinic acid receptors in your skin, and really specifically, you know, it's really targeting the damages of photoaging, right? So
Okay.
using tretinoin helps with cell turnover, right? And keeping like cells fresh, right, on the surface of your skin.
Yep.
But it's also working to improve collagen production and preventing the degradation of it. It also can help with like roughness of the skin as well as some discoloration, right? So it works great on all of those things.
Yeah.
Um, Topical estrogen complements it, can be used with, they can be used alone, they can be used together. Because estrogen's targeting the hormonally
Yeah.
mediated changes, right? So what is estrogen particularly targeting? It's increasing hydration because it increases hyaluronic acid production, because your face, yes, your skin makes hyaluronic acid. It also increases collagen production, elastin production, and lots of other things that help support kind of like this matrix. Like I like to show people, like there's like this support matrix that's really robust and strong, and as you age, it kind of breaks
Mhm.
down and it's a little bit more loose. So you
Okay.
don't have that same structure, right? That's why we see more sagging and more looseness. So
Right.
by helping plump up and, add to the support, topical estrogens really help with that. And then the tretinoin is also, doing
Yeah.
its thing.
That's
Yeah.
amazing. That's also just a super helpful explanation about why they work so well in tandem and what they're really attacking, if you will, and
Yeah.
supporting over time.
Yeah,
Um,
and some women can't, most women can use tretinoin. I just want to say
yeah,
it, and more doesn't mean better. We can start lower and work our way up. But there are some people who have super sensitive skin and they want to do something else besides a prescription retinoid. And so this is where this is also a great option
right.
to
Terrific.
use
Thank
estrogen.
you.
Yeah.
That's a really good call out. Thank you. Um, okay, I want to pivot a bit to clinical results and let you hover a little bit more on the
Yeah.
safety aspect. So the clinical data behind M4 is really compelling. Can you share some of the key findings from the recent study, especially for the new eye cream, which
Yeah.
is really it's like I don't have good words enough for it. It's
Yes.
excellent,
So I
excellent.
think it's important for everybody listening to understand the background is that when we launched the original M4 face cream line, right? We did do a clinical study, which I think is really important. It sets us apart that we're putting like our money where our mouth is and our
Mhm.
time and our efforts to not only citing the available scientific data that we have from the medical literature on facial estrogens, as well as how we can, use the information from the topical, vulvar, or vaginal estrogens on, how it works on skin. But then we went further and said, okay, so let's really test this. And we had incredible results and wonderful data out of that M4 original study. And so
Right.
then we built on that study, right, by saying, okay, like, how can we expand things and target other areas that women care about? And of course, everyone's really concerned
Yeah.
about the thin tissue underneath our eye. And so we did a clinical study specifically looking at a bit more higher concentration. So we're using a smaller amount, a slightly higher concentration, and understanding we stuck with estriol because even at a higher concentration of estriol, this is still 10 times less potent kind of from a
Right.
systemic level, right? So that's why we capped with the estriol. And we contracted with a third party, lab. And I have a couple of things I wrote down because I always want to
Sure.
make
Please.
sure I say it correctly. I'm going to give everybody the best information, right? So, we partnered with a third party FDA registered lab. We enrolled women between the ages of 40 and 70, different skin tones, different hormonal stages, and they used our M4 cream. So if anybody wants to go back and they can, everything's on our website. Look at our original M4 study. It's all there. And now the eye cream study is also published there. But this is what we're going to talk about. So they use the M4 eye cream for 12 weeks, so 1% estriol. Um, and they used all the fancy scientific things to not just get
Right.
information subjectively from women on how do they feel before and after. And yes, you can use it on your
Yeah,
eyelid
I was just
because
gonna
it's
ask.
eye.
Thank you, Dr.
Someone
Menn.
else. But they use, I'm not going to say it right, corneometers to measure skin surface hydration, moisturometers for deep hydration to measure that below the skin, cutometers to track elasticity and firmness, Antera 3D imaging to analyze the wrinkles and the skin texture, and then expert dermatology, expert graders that are trained specifically to, use things to identify the visible changes like crepiness, crow's feet, fine lines. And then we also asked women how they felt, right? So we did all of the good work and
Yeah.
we checked estriol levels to make sure we were not increasing serum estriol levels, right? And there was no change whatsoever, okay, which is
Terrific.
great news. And this just continues to support what we found in our original study and what all of the literature supports. So
Right.
I'm so proud we're building on this scientific literature, right? And then the results. You want to know the results,
I
right?
do.
So I have them written down so I know that I'm saying them correctly. 36, so at the 12-week mark, 36% reduction in wrinkle appearance, 33% improvement in firmness, 40% improvement in elasticity, 40% less
Wow.
crimpiness around the eyes and eyelids. Hydration was boosted by 22%. The list goes on. And women's subjective responses as well is that
Yeah.
they just were very, very happy. The numbers are, you could see them on our website, but like over 70%, happy with, how much their skin improved. And I hear this from patient feedback like all the time.
Hmm. Yeah,
um,
I do
so
too. From women in support groups. Dr. Menn, you touched on this. I just want to give you a moment to
yeah,
elaborate, if you will. Topical estrogen products like M4 does not, according to this study, increase estrogen levels in the body. Can you
yeah,
just
sure.
hone in on that
And
a
it,
minute more?
and really important, we chose to use estriol. And you have to understand that estradiol, estriol, estrone. These are all different estrogens. Estriol cannot convert in your body back to estradiol. Okay. Right.
Important.
Really
Great, great,
important
great.
because we know different hormone precursors can change. DHEA
Yes.
can change to different things. Testosterone
Testosterone,
in
yes.
high amounts, not in
Mhm.
lower physiologic amounts, but in higher amounts when people are getting very high doses, it can potentially, through enzymes, get converted to estradiol. This
Right.
does not happen with estriol. Estriol is the end path, right? This is it. You cannot get estriol converted into estradiol. And really important that both in the original M4 study as well as the I study, which is using a little bit higher percentage, but in a smaller amount,
Hmm.
um, no, there was no increase above baseline of what their estriol levels were and after. And
Terrific.
in the original M4 study, we went an extra step further and made sure we knew it wouldn't happen, but just to show that there's no change in estradiol levels either, right? This
Amazing.
face cream is not going to help you with your hot flashes. It's not going to cause vaginal bleeding, and it's not going to cause breast tenderness, because
Terrific.
those are things that happen when we get systemic absorption.
Fantastic. Thank you
Yeah.
so much for all of that, Dr. Men. That was great. Pivoting a bit, and I see questions coming in. I am going to get to them, I
Yes,
promise.
we will.
Um, just another question, sort of the inverse. Is there anyone who should not use M4, or is it really generally well tolerated?
It's really well tolerated and safe for really everybody. We always, so listen, this is a prescription. So when you come to Alloy, you're going to fill in a skin intake form. You're going to tell us, do you have allergies? Because there's other ingredients in
Right.
there like aloe, niacinamide, there's peptides, there's other things in it in the base. We want to make sure you're not allergic to something, right?
Perfect.
We do ask your medical history mainly so that we can reassure you and guide you, right? So, if someone, the biggest question, the pink elephant in the room, but I have a family history of breast cancer, or I carry the BRCA mutation, or I have breast cancer, right? So then we're going to advise that patient based on their history. The disclaimer is that unfortunately, we don't have studies of
Right.
this in breast cancer survivors. But what we do know, and we can reassure patients, and they can with shared decision making, is that it's not raising estrogen levels. We have very, very robust data on a much more potent, 10 times more potent estrogen, estradiol, used in vaginal hormone products. And if anybody watched the FDA panel, that's what everybody was talking about, how vaginal local estrogen, really there's no contraindications that even patients with active breast cancer can use local vaginal estradiol. So I say, listen, you're a grown up woman, we can share decision making that topical estriol much less potent, not systemically absorbed, and you can use it, right? But if you have any concerns, we'll give you the information and you can speak to your own, if you have a medical oncologist or a team. And I'll just shout out Dr. Eleonora Teplinsky, one of my favorite medical breast
Yes.
oncologists out there. We're going to have her on, I think, one day soon with Alloy. She's
Fabulous.
wonderful.
Yes,
And
she is.
she answers this a lot in her Instagrams and in her stories, and that yes, she is comfortable letting patients use that. If there are patients who have concerns, this is why we have Alloy expert physicians. So we'll clarify that. But if you have a history of a blood clot or a stroke or heart disease or a family history of anything, you can tell us about it, but we're going to tell you topical estrogen is not contraindicated.
Well, thank you for all of that, Dr. Men. Actually, one of the reasons I really wanted to have this conversation with you is because you have a personal and professional extensive
You could
knowledge
say.
of breast cancer, conversation, literature. It goes on and on. And you are as dialed into studies as anybody on sort of connections between
Yeah.
products that women use and can use safely, and their overall health. So
Yes.
thank you for that. Let's get to questions a bit before we pivot
Yeah.
to just you actually just touched on it, but I do want to sort of let people know step by step sort of how to walk through the process on the Alloy platform.
Yeah.
Um, I knew we were going to get this question about melasma.
Sure.
It
It's an
comes up
important
all
question.
the time.
Yeah.
Yeah,
Of
can you
course.
address that? People
Yeah.
say it's causing melasma. It's clearing up my melasma. What's happening there?
So what we know about estrogens is that estrogens in any form can trigger melasma, right? The most common association is with the very high. When I say high, I mean very high, tens of
Really high.
thousands, hundred
Yeah.
thousand of estrogens in pregnancy, or the extremely potent, much higher systemic synthetic estrogens in birth control pills. So pregnancy, birth control pills are the two biggest triggers in terms of hormonally mediated melasma, right? Because it's stimulating the melanocytes and causing, that changes in the skin color, right? So if you have a history of melasma that was really significant after pregnancy or where you're on birth control pills, and we don't see it as much in menopausal hormone therapy systemically, but it can happen, right? Because I always remind patients, we're all a little different and our
Yeah.
receptors all respond differently. So if you have a history of melasma, you can still use M4. You're going to use it with caution, and you might want to start maybe with a small area of your face that never had the melasma, or and try it for
Patch test. Yeah.
a few weeks, a month or so, and then you can kind of expand it. If you noticed that it was exacerbating it, then it's not for you. But most of the stimulation of melasma comes from a much deeper level internally, the receptors being stimulated by higher systemic levels. Do I think it's going to cure your melasma? No. Okay. I think it's going to make your melasma better. And remember, melasma is not the same as brown spots and aging spots, which is totally different. That's not going to do anything. It's not going to worsen those brown spots.
Right.
But M4 is not going to change aging brown spots. That's where you might want to talk about tretinoin.
Yes, I love
Yeah.
that. Yes, exactly.
And then also speaking to your own dermatologist, there's more in-depth things that you need if you're having that.
Yeah.
But again, the M4 intake process for whether it's the eye or the facial creams or serum, which we'll talk about, again, it's a few questions that are targeted and very important for us to evaluate skin questions. And then you get, assigned a physician like myself or one of my amazing physician colleagues, and we're going to go through everything. You could
Right.
send us a picture of your face. We can message back and forth. We give you a 3-month refill, a 3-month supply. And if you want to make changes, you can along the way at any time because you have unlimited messaging with us. So, and if you are concerned about sensitive skin or how to layer or how to add and all of those things, that's like part of our management and the access to the experts
Yeah.
that we have.
And can I just say, as a layperson in this conversation, but I know this much is true, no matter what, please wear sunscreen, no matter your skin color, no matter your skin, if you're freckled, if you're not freckled,
Yes.
slather on your sunscreen, especially if you're using
Fentanyl.
tretinoin. Yes, thank
Yeah,
you
yeah.
for
I mean,
that.
that's the mainstay. So I always like to shout out Dr. Ellen Gendler, who is actually one of our
Yes.
advisors, and she's an incredible dermatologist. She spoke 2 years ago at the Menopause Society annual scientific meeting in front of thousands of menopause doctors. Um, and she talked about her mainstays, and her three mainstays was sunscreen, prescription retinoids, and estrogen,
Wow.
which made
Fascinating.
everybody like be like,
Like,
"Ooh, yes,"
whoa.
because no one talks about it in the face until we started talking about it, right? And so, so she was an incredible, source of information. But it kind of hones down to in midlife, you don't need a gazillion bells and
Yeah.
whistles. You need things that actually work. And
Work.
where are you going to spend your money on? A bunch of like over the counter stuff filled with fragrances, really all special branded marketing things that aren't really based on
Right.
a lot of science,
Right.
frankly,
Science. Yeah.
versus something that is prescription based that we know works, right? Um, and so I think that's important. So I have found that women do best as they get older with keeping things simple, targeted, smart, evidence based. Because your skin is getting a little bit more sensitive as you get
Sure.
older because of the loss of estrogen, right? And so you have to be careful introducing all sorts of
Yes,
gobbledygooks to your
absolutely.
face.
Absolutely. Thank you so much for that, Dr.
Yeah.
Men. I love this next question because it actually gets to sort of the birth of M4.
Mhm.
Can you use vaginal estradiol cream on your face? What's the
Yeah.
difference between what you market for face
Yeah.
versus vaginal cream?
Yeah. It's a
I love
great,
this.
great question. And listen, we know for years people have been taking their vaginal estrogen, and Dr. Gendler said that she did it herself for years with her patients. And and she would use it, on face, right? And our own co-founder, co-CEO, Monica, it's like her famous story. She loves to talk
Yeah.
about how she was like, well, if it's good for my vagina and my vulva, what about underneath my
Let
eyes
me
and my
throw it on my
face?
face. Yeah.
And of course, and she did see improvements. But here's the
Yes.
differences. And if you want to do that,
More power
Go
to you.
for it. Go
Right.
for it. More power to you. But if you test out the consistency and you look at the
Yeah.
ingredients in a vaginal estrogen, the ingredients are safe. I do not want to make anybody afraid of vaginal estrogen ingredients. The difference is it's estradiol versus estriol. And
Right.
because we do not have, let's make it clear, we don't have an FDA approved face product. We should,
Mhm.
but they all dropped the ball because of the WHI, and there's not going to be one who knows when, right? So we are meeting this need because there's interest, there's science, and it works, right?
Right.
But we chose estriol, and we chose it, remember, for a reason. It's weak in terms of systemic absorption. We're using it in low doses. You can't get absorbed systemically, but even if it did, it's weaker. So that's one difference. Weaker doesn't mean worse when it comes to skin, though. So I want to
Right.
remind everybody that in Europe, the estrogen that they prescribe for vulvar and vaginal skin is estriol.
Yeah.
Same percentage as our estriol facial cream. And there's tons of safety and effectiveness. So that's one difference between vaginal estradiol and that. And the other thing is there's ingredients in vaginal estrogen that really are help absorption in the vaginal wall in the
Right.
vagina, and also are preservatives that are important when you are mass producing, shipping, storing, and you want a long shelf life on
Great
something.
point.
Those are not the same things that women look for in their
That's a
skincare.
great,
So
great
when I
point.
ask
Yeah.
a patient, so you're spending a gazillion dollars on all of these over the counter things, because you want clean and you want this and you want that, but then you're willing to just take something that's formulated for your vagina and you want to put it
Yes.
on your face. And you can do that. That's cool. And that's
Right.
fine. But like a little bit of common sense there. And then the other thing is that I do know, and I always warn people, if you put your vaginal estrogen on your face, particularly by the eye area, it can cause burning and stinging in your eye. So I would be very, very careful with that. And then it's also just down to consistency. It's a little bit
Yes.
more, I'd say, like a little waxier, a little bit more
It's
greasier,
tackier, right? It's like
tackier.
stickier, thicker.
Yeah, I mean, I don't know many people who really want to rub vaginal estrogen all
Yeah.
over their
Yeah.
face. So the consistency of the base matters. So ours
Right.
has like peptides in it, which have been clinically shown to be helpful. And you could read more about that. We have that all listed on the website. Aloe, niacinamide, which helps with skin barrier and inflammation. So we have very nice bases. And then we could also talk about the really nice differences between like why we did a serum and a cream and
Yes, yes, we're getting to that. We're
that
getting to
kind
that.
of like
Sorry, Dr. Mann. You got me excited. Um, just take us
Rachel.
through really quick. Dr. Mann and I have our own little private secret joke, and it's this. Um, take us through really quickly again, sort of how the order process is for people who are not yet Alloy customers. I'm just wanting people to understand, again, you do need to fill out an intake form. We do
Yes.
need to collect some of your history and so on. Go ahead.
Yes, yeah, we this is a prescription and we
Yes.
take this seriously. We review this with, you're going to be reviewed by either me or one of our other wonderful doctors. And so it's not a long intake if you're just coming for skin alone. If you are also seeking help with weight care, if you're seeking help for menopausal hormone therapy, those are separate intakes. And if you are already a customer, you can add on by
Right.
just doing a short intake for the skincare. I'm sorry, was that what you asked me or
No,
did
no,
I?
no. That's
Yes,
perfect. Just that you need to do an intake form. It is a prescription. You'll hear
yes,
back from your physician, and
yes.
then get your show on the road. Get your product in the mail.
Mhm.
Dr. Mann, can you walk us through what our product line
Yeah.
M4 offering is?
Yep. Yep. So the original M4 cream, right? So that is just a nice, creamy base, and women can use it, in the morning. They can use it at night. They can use it both. They can use it on their face and pull it down onto their neck. That's cool too. You might run out of it a little sooner, and then you could ask for a sooner refill. All good. We love the original M4. That's what started it all.
Right.
So then we added, so now we have the M4 serum, and so that's different in that it's I tell women it feels most like I happen to have it right. So I will
Yay. I
show
love
you.
show and tell.
I should have been a QVC person. So this is the cream, so you can kind of see. Let's see if it shows up on here. So
Yep.
it's like it's white, it's thicker, and it's like really it's a little bit more moisturizing. So like for me personally, and I also when my patients come and ask, so it absorbs really nice. There's no weird cast or anything. So I until the serum was created, I would use this morning and night. Now I use the cream at night, and then the serum um, is also the same amount of 0.3% estriol, and it has peptides in it. So the serum looks a little different. And I don't know if it'll show as much
No, I can see
on
it.
here, but it's clearer. And when you rub it in, my hand is going to look good today. When you rub it in, it feels like a primer, like a really nice
Yes,
beauty primer. So like I put it on my face and it's like a nice primer, like on top of, like, say you're going to put makeup on top of, right? Of course, you're always going to put this on and then your sunscreen. And then if you wear makeup, go ahead and do
right,
that, right?
right,
So what, and some women might just prefer the serum in general. They just like serum. So then they can use serum morning and or evening. A lot of women, myself included, is doing the primer in the or the serum in the morning and the cream in the evening. And then the eye cream is smaller bottle. You're using a lot smaller amount. The pump is small. And a little goes a long way. Like I don't even need a full pump. I think
agreed.
this is gonna last a while. So we're using a much smaller amount and it rubs in really nice. Like you can put it, I just put it underneath my eyes, right around here. And if I have a little extra, I might pull it out
I love
a
it.
little bit. But yeah, so a little goes a long way. So it's a very small amount. So it is a higher percentage. It's a 1%. That's what we studied versus the 0.3%. But again, higher percentage, smaller, much smaller area. We're not taking this and applying it all over our face. If you're going to use
Right.
it all over your face, you're going to use the serum or the cream, right?
Can I just say one thing too? Having used the serum, first of all, it's beautiful. The consistency is lovely. Someone asked, I think, is it silicone?
No, not in the way that it feels like a
Yeah, not
layer, and it
no.
absorbs.
It absorbs really nicely. I have to say, it's not a makeup primer, although
No,
like we can use it like that.
yeah,
But it's not. It's I find like particularly here where I have fine lines, it's like it just sort of smooths everything out.
yeah,
Like
yeah,
I'm not needing as much around here to sort of like try and mask fine lines
yeah.
with the serum. It's
I mean,
beautiful.
it's still moisturizing, so that when
Yes,
you put it
extremely.
on, you feel a little bit more like plumpness. I mean, obviously it's a
Yes.
feeling; it's not magically pumping your skin, but there is a nice consistency, and I think that has to do with the base of what we
Yeah.
chose. So yeah, it's a nice someone right creates a nice smooth
Yes, that's
finish. I think,
perfectly said.
yeah, and I just also think sometimes there's personal preferences,
Right.
right? So some people like one
Perfect. Yeah,
versus
so well
the
said.
other. And then I would say, and then I know we're not talking about tretinoin per se today, but I just wanted to kind of say like the base is somewhat similar to the tretinoin base, and the tretinoin base, and this is why I think base matters. Like it's like the tretinoin base is really
It's not
um
like your typical retin-A.
no. So the retin-A, which I've used the kind of the commercially available versus our version. It's like thicker, it's like glassy white. It's a little different, right?
Yeah.
I find this to just like blend really seamlessly in, and because it has aloe and niacinamide in it, I find that it's like a little bit people tolerate it. I find it a little bit better. I really love the consistency of
Yeah.
tretinoin. So yeah, so I use
Thanks for that,
them
Dr.
all.
Ben. I just want to call out this very kind comment that Glowopedia, I love your name, Glowopedia. I don't watch a lot of lives, but when I saw Alloy was live, I knew it was going to be educational and good. That's really
Yes, we
kind
try
and
to keep
thoughtful.
it.
Yeah, we do try and
Yeah.
keep it there. Um, You mentioned sort of your using one in the morning, one in the evening.
Yeah,
Can you layer
sure.
all, and I don't want to, I shouldn't throw the eye cream in there because the eye cream is specific to
Yeah,
around the skin of the eyes, but can you use the serum and the M4 cream
you could.
together?
You
Okay.
could. You could. Because the good news is when we studied like blood levels of the cream, we made sure we looked at it when people were using up to 3 pumps, right? So that
Mm,
we know if you want to use like a 1 pump of the serum and then maybe you have extra dry skin, you want to do an extra pump of the cream, that's fine. The reality is if you want to, I'd say like from my perspective, if you really want to optimize things, I personally think like doing one in the evening, one at night makes sense instead of like layering the same thing on top of each other, the eye cream being separate. But everyone has their way of using it. Some people
Right.
might like to use the serum everywhere and put maybe a little pump of the cream here, or their forehead, or where they're a little extra dry. So I think it's kind of nice, especially when you're starting this.
Yeah.
Try them out, like get the little set, and then you can kind of mix and match to make it work for you.
Okay, perfect. Thank you. Is it okay to keep using, if you have favorite skincare products, like a vitamin C, for example,
Sure.
can you use it alongside any
Yes.
of these M4 products?
For
Okay.
sure. Like a common sense thing is thinner to thicker, right? That's how we layer things,
Mm-hmm,
right? So if
mm-hmm,
you have a very thin, like liquidy vitamin C serum, then you might want to put that first. And if you have
hmm.
products that are being prescribed by your own
Right,
dermatologist,
right.
you should ask them so that you are using your products that they're prescribing in the right way. And this is why you're also having um, a consult with a physician, so you can tell us what else you're using. We'll tell you what to do. But if you're using over the counter products, like say you love your serum for whatever reason, whatever kind of serum, or you're a really thick moisturizer that you like to use at night, use it at the very end if it's thick, use it at the beginning if it's very thin. That's all. It's just kind of
Perfect.
common sense.
Dr. Mann, you have answered every single question I had to throw your way. I'm just looking for a moment to see if any others came in for us.
I'll just say a common thing
Please
I know I
do.
get is rosacea. So
Thank you.
I
Yes.
have rosacea myself, and I've really gotten it under control over the last number of years. Um, the data that is out there does not suggest that topical estrogens exacerbate or worsen rosacea. Certainly, anything that improves the skin barrier, estrogen, hydration might, kind of overall help. If you have rosacea, you need targeted, evidence-based options. Stay tuned on that.
Bang, bang, pow, pow.
um, but rosacea should not get worse, and it's likely that incorporating it over, something in the M4 line is going to, you know, it may help. It's not going to cure your
Not
rosacea.
going to cure. Okay.
Yeah.
Um, this question came in. It's actually about vaginal estrogen.
Mhm.
And I just want to take our last minute or so to
Yeah.
cover this in case she is not the only one with this question. She's asking the vaginal estrogen comment from the recent FDA panel. Is it now not safe for women? She's unclear. Can she be using vaginal estrogen? Should she be worried about using vaginal estrogen? I don't want
Oh,
to.
no, no, no. There should be no confusion coming out of that FDA panel. That FDA panel was comprised of scientists, physicians, some longstanding leaders from the Menopause Society, and very respected people. And universally, everybody is in agreement. The Menopause Society, ACOG, literally everybody, American Urological Association. Vaginal estrogen is safe, effective for everybody. It does not cause increase in systemic levels. And this is why we have so much good data on local topical estrogens, right? And so don't be afraid. I don't care whether you have breast cancer or a massive stroke. You can use vaginal estrogen, right? So that is very, very safe. And actually, that FDA messaging is actually quite reassuring for what we're talking about today, because we're talking about even lower dose, lower potency estriol
Mhm.
on face. So it's all actually really reassuring. And if
Thank
anybody has questions about this, go to letstalkmenopause.org and look at their petition to the FDA. They have everything laid out of why we want that label removed, because topical estrogens that are local low dose do not cause breast cancer.
Thank you for that, Dr. Menn. And for any other questions about M4, the products, the studies, head over to our website, myalloy.com. If you have more questions for yourself, and whether it's about weight care, skin care, sexual health, hormonal health, you can fill out a intake form and get connected with a menopause expert who can answer all of your questions. No commitments beyond that. Dr. Menn and I are sort of back in our Instagram live rhythm, so you will be seeing us again. I believe our next conversation will be on weight care, but don't hold me to it. I love speaking with you, Dr. Menn. It's always
Love talking
just
to you.
like energy education straight off the bat. Oh, we have someone, Holly, who
Holly,
says,
it's my
that's my
doctor. Oh,
doctor.
yes, that's my patient. Right, Holly? I just want to say it is safe for acne prone skin, and we were able to, based on the clinical studies, to get officially, the label that it's non comedogenic, won't clog
Right.
pores, and it's clinically tested on sensitive skin. And I personally have not seen, and I've been prescribing topical estrogens now for a number of years, 3 years or more, and here in Alloy and in my own practice, and I do not see an exacerbation in acne.
No, and I had terrible hormonal acne for many years. MHT did clear it up for the most part, but any sort of like occasional breakouts I might get have absolutely nothing to do with my use of M4. It's usually my lack of stress mitigation. That happens too. All right, guys, I'm signing us off. Thank you so much, Dr. Men. Just a
Thank
pleasure.
you.
Thank you to
Lovely to see
everybody
you.
who came and who left your comments, your questions. I appreciate them, and we will see you soon.